It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. My dog has blood in his eye. What should I do? Seeing blood in your dog's eye can be alarming. The technical term for this condition is hyphema, and it can occur for a variety of reasons. Let's explore it in more detail, including the causes, treatment options, and prognosis. 1. What is hyphema? The term hyphema is used to describe the accumulation of blood in the most anterior part of the eye, as well as any associated inflammation. This region is known as the anterior chamber and is the space between the iris, the colored area around the pupil, and the cornea, the clear outer surface of the eye. The eye will appear cloudy, opaque, and red in color. You may also notice small clots. It may affect just one eye or both. Your dog may also exhibit other clinical symptoms such as blindness, rubbing or pawing at the eye, depressed attitude. 2. What causes blood in your dog's eyes? There are a number of reasons why your dog may have blood or hyphema. These may include trauma to the eye or head, blood clotting problems, which cause spontaneous bleeding in the body. This can occur due to a primary problem with the dog's clotting mechanisms or due to a toxin such as some rat poisons. Cancer in the eye, retinal detachment, the back of the eye separates from the underlying supporting structures. Glaucoma, increased pressure in the eyeball. Uveitis, inflammation of the middle section of the eye, including the iris and ciliary body. High blood pressure. Infectious diseases, including leptospirosis. Tick-borne diseases, including Rocky Mountain spotted fever and ehrlichiosis. Congenital eye disorders in certain breeds such as Labrador Retrievers, Bedlington Terriers, Springer Spaniels, and Border Collies. 3. How is hyphema treated? Treatment for this condition depends largely on what the underlying cause is. In mild pathological processes that are treated early, the signs of hyphema may be reversible. However, in some cases where the eye has been severely damaged or if the underlying disease is severe, this is not possible. In these cases, removal may be necessary, especially if the eye is sore, unable to see, blind, or has an invasive tumor. Other treatments for hyphema might include eye medications such as topical steroids to help control inflammation or specific treatments to reduce intraocular pressure in cases of glaucoma. Patients with clotting problems might require a transfusion to help increase platelet counts and clotting factors. Antibiotics and systemic anti-inflammatories may be required in cases of trauma or infectious disease. Medications to counteract high blood pressure might be needed if hypertension is diagnosed as the underlying cause of the problem. Will my dog be okay? Prompt intervention is key. As with all things, the sooner you get your dog to the vet, the sooner they can diagnose and treat the problem. This will limit damage to the eye and increase the chances of reversing hyphema. However, some underlying health conditions are more easily treated than others. Your vet will be able to explain all of this in more detail based on their findings. 4. How is hyphema diagnosed? Hyphema itself is obvious to the naked eye. However, there are a variety of reasons why it may have occurred, so your vet will need to perform a few different tests to gather as much information as possible. In many cases, not all of these tests will be necessary. Your vet will select the ones they feel are most appropriate for your pet and discuss them with you. Hyphema is the technical term used to refer to blood inside the eyeball. This blood is seen in varying degrees in the front of the eye, causing it to appear red. There are many different underlying reasons why a dog may experience bleeding in the eye. Early intervention is important, so if you notice your dog's eye doesn't look quite right, take him in for an examination right away. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.